How do you interpret tuberculin skin test, TST, results? Imagine a simple skin test that can tell us if someone has been exposed to tuberculosis, but understanding what the results mean requires careful interpretation. When a healthcare professional performs a tuberculin skin test, they inject a small amount of purified protein derivative into the skin of the forearm. After 48 to 72 hours, they measure the size of the induration, which is the raised, hardened area at the injection site. Remember, only the swelling is measured, not the redness around it. The measurement is taken in millimeters with a ruler across the widest part of the induration. The key to interpreting the results lies in the size of this induration and the person's risk factors. For example, if the induration measures 5 millimeters or more, and the person has a high risk of tuberculosis exposure or immune suppression, this is considered a positive result. Such high-risk groups include people living with HIV, recent contacts of someone with active tuberculosis, or those with a history of organ transplants or immunosuppressive therapy. For these individuals, a 5 millimeter induration suggests they may have been infected with tuberculosis bacteria. In contrast, for people with moderate risk factors, such as those born in countries with high tuberculosis prevalence or injection drug users, a 10 millimeter or larger induration is considered positive. This includes residents or employees of high-risk settings like prisons or nursing homes. If someone has no known risk factors, an induration of 15 millimeters or more is needed to be considered positive. This higher threshold helps prevent false positives in low-risk populations. It's important to remember that a positive TST indicates infection with tuberculosis bacteria, but it doesn't tell us if the person has active disease or latent infection. Additional tests, like chest X-rays or sputum analysis, are needed to determine if the person has active tuberculosis. Also, the interpretation must consider the person's history. For example, prior Bacillus calmette-guerin vaccination or exposure to non-tuberculous mycobacteria can sometimes cause false positive results, especially in people with moderate or low risk. Sometimes, especially in older adults or those previously infected or vaccinated, the immune response may weaken, leading to a false negative. To account for this, healthcare providers may perform a two-step testing process. The first test might be negative, but if a second test is positive after 1 to 3 weeks, it suggests a boosted immune response rather than a new infection. In summary, reading a tuberculin skin test involves measuring the induration size in millimeters and considering the person's risk factors. A positive result prompts further evaluation to confirm whether the infection is active or latent and to decide on appropriate treatment. Always remember, this test is a tool that must be interpreted carefully within the full clinical context. If you or someone you know has a positive TST, consulting a healthcare professional is essential for proper follow-up and care.